Hi, my name's Sylvia Clemons. I'm a licensed professional counselor, and I'm also part of the Center for Apostolic Counseling. I wanted to take a few minutes just to share some thoughts with you about something I think is important to be aware of in our current situation. So here we are in the middle of April 2020, and we're facing some quite unprecedented times with this COVID-19 pandemic. And it's affecting us all in many ways as individuals, families, churches, communities, and even nations across the world. And one of the tactics that we're using to help slow and minimize the spread of the virus, we're calling social distancing. And that has caused many of us to start working at home, children doing their schooling at home, no more church gatherings, worshiping together. It's online now. And it all has happened so quickly that I think we're still trying to adapt and adjust in many ways. And I think as Christians, we're also having to try to think out of the box. How do we continue to minister to others? How do we stay connected in our church families and to our community? And I think we're rediscovering that the church is not a building, but the church is us. But with the social distancing and the isolation, many of us are experiencing what one of our most precious, most vulnerable populations, our older adults, have long experienced: loneliness. Many years ago, when Mother Teresa was asked what the worst disease she had ever seen was, many expected her to say leprosy or AIDS. But no, she said it was loneliness, that terrible feeling of being unloved, unwanted, forgotten, isolated, and alone. And the truth is that social isolation can be very tough for many people. And for our senior citizens, it can even be very unhealthy. Statistics tell us that as many as 28% of our seniors live alone. And the National Institute of Aging says that social isolation and loneliness are linked to higher rates of high blood pressure, heart disease, obesity, weakened immune system, anxiety, depression, cognitive decline, Alzheimer's disease, and even death. More than ever, I think we should cherish the lives of elder adults and mobilize across generations in an effort to combat this disease of loneliness that's going to linger long after a vaccine is discovered for COVID-19. There are many ways that we can reach out and stay connected even without direct face-to-face contact in these times. So if you have seniors in your life personally, in your church, your neighborhood, here are a few suggestions for reaching out. Of course, many seniors are not as connected on social media, but most do have a phone. So make calls often to check on them and just see what their needs might be. Chat with them for a moment. Share uplifting scriptures, words of hope and encouragement, assurances that people are praying for them and that God knows them by name. Ask if they're in need of groceries or medications to be picked up, or ask if they need assistance in finding out how to have those items delivered to their home directly. If they aren't already connected to social media, offer to help them get connected so they can watch church services online and receive the communication, email, text, videos, any of those things that are posted and sent out. If an elder adult is in a nursing home or in a hospital and visitors are prohibited, phone calls and social media connections can be even more vital in helping them stay engaged. Dropping things by for a staff member to give to them if possible can also be a very caring gesture. Some of us older adults are still very engaged actively and even professionally in a career. But encouraging one that you know of to be aware and to be cautious in these times can be very important. It isn't always as easy for us to adjust a routine or even to realize the seriousness of a threat that we are facing in these days. On the other hand, it could be important to encourage the limitation of exposure to the ongoing news and the inundation of the dire predictions and things that are going to happen. When we have a steady diet of that kind of thing, it can become very debilitating and even increase fear and anxiety. We need to be realistic and know what's going on without becoming obsessed about it. Talk with them about the future. When the world is in a state of panic, we need to remember that remaining hopeful helps ease new transitions. Talk about plans to get together again. Talk about how excited you are for them to fix you your favorite meal again. Talk about a granddaughter or grandson's upcoming graduation or wedding. We need hope in times like these, to be sure. And so be sure and pass it on to the older adults in your life. Encourage them to continue taking care of themselves, washing their hands, taking their medications, opening the blinds in their home to let the light in and the air. Help them keep moving at whatever level of exercising or activity they're able to do. And do things in their home that are comforting to them. So again, these are just a few suggestions on how we can stay connected with and minister to the older adults within our circle of influence. But be sure as you incorporate any of these ideas or anything else that you might think of yourself, that you do so in a very respectful, humble manner. You're not there to tell them what to do or how they have to change their lives. You're there to assist, to love, and to encourage. And remember to communicate all things effectively and calmly. This is a very stressful time, so more than ever, we need to practice peaceful unity. And hopefully, when this time is past and we've moved into a new kind of normal, we will continue to remember that isolation should not be a disease suffered by the elders. We can stay connected and stay encouraging, blessing them in many, many different ways. So I hope this has been a little helpful to you. And remember, we are all admonished, every single one of us, to cast our cares upon the Lord because he cares for us. God bless in Jesus' name.